I know how hard it has been for parents over this past 2 years. In addition to being a pediatrician, I'm also a parent of two youth. And I don't think there's really any family who hasn't been impacted by COVID in some regard, and particularly when it comes to mental health. And I think for many people, it has been an emotional roller coaster. And nothing is harder for parents than worrying about the health of their children. And I know for all of you that are tuning in today, that has been top of mind. And I think, as Ed said, I think one of the spaces we've really struggled with when it comes to COVID in children is sort of acknowledging that two things are true at the same time. As Ed very clearly articulated, COVID is really not presenting a much higher risk to children in terms of their acute health than the other respiratory viruses that we're very used to dealing with as pediatricians. And I think it's been a lot of real scare tactics directed at parents to make them really feel disproportionately worried about the risk for their children. And I think that's made it very hard for parents who are looking at all the public discourse and the decisions by government to ever really feel like their children are safe. The reality is we now have a very effective vaccine for kids 5 and up, which should allow our children to be in school very safely. It's providing excellent protection against that very rare outcome. And again, want to emphasize it's rare, as most children who get COVID will have a typical course like any other viral illness. But those children, and we don't want to minimize that, of course, we want to prevent any bad outcomes that we can, and the vaccine's very effective at doing that. But I think along the way, we've lost a bit of the context that all the other things that we're doing are actually impacting all children. We've seen extensive service shutdowns, we've seen many children not able to go to school, and we've seen a lot of community-based services for children interrupted. And that's impacted people's development, that's impacted mental health services and supports, and it's impacted the normal social aspects of children's lives that are so important for protection in terms of their mental health. And of course, in parallel to that, we've had their parents who have been stressed, trying to manage work, trying to manage kids being home, their own concerns about their health. You may be caring for elderly folks in your own family or have your own underlying medical problems that have made you particularly worried about COVID. So there's been a lot of things happening in parallel. So as Ed said, our work at the CMA has shown very clearly that the mental health of all Canadians has declined significantly during this pandemic. And I don't think that's any surprise. But unfortunately, when it comes to children and youth, I think what we have seen is not enough centering of the needs for children and youth in terms of our response to this pandemic. We have been so concerned about the impact on the acute care side of the system, and not to minimize that because that is significant and it's been extensive. But often in those conversations, we've lost track of what is happening to children and youth and what resources are being put in place to address this freight train, as Ed aptly said. So right now at the CMA, one of the things we're really focused on is really two things. One, continually bringing to the government's attention the importance of advancing some of the election promises we saw around mental health and making sure that those resources are available for children and youth, as right now so much of that care falls outside of what we consider a universal but not really healthcare system. And that's a huge issue, and we're advancing that daily. The other piece is really trying to bring forward conversations about what we want our health system in Canada to look like. We know that really what universal healthcare is in this country is doctors and hospitals, and that is not where most children with mental health challenges end up. So it's very critical that when we think about mental health in children, we realize this is an extensive problem. It's impacting children from infancy through to adulthood. And we need to have robust systems in place in our community that are timely, accessible, so that all children can get the supports they need and we don't end up with a generation that doesn't recover or meet their full potential because of this pandemic. So I'm really grateful to this event today. I think it's critical. And for parents, I just want all of you to know you're doing your best, and that's all any of us can do right now. And the fact that you're here means you're going to be part of the solution. So thank you so much.